Hello everybody, and welcome to Species Specifics. Today we're going to be looking at snakes. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not specifically mentioned, but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I've also highlighted key, easily recognizable characteristics in bold. There are only a few notable diseases to remember about snakes for the NAVLE, so I've put them in no particular order. We will start with infectious stomatitis, which is also known as mouth rot. This condition is usually caused by Aeromonas or Pseudomonas infections. Clinical signs include petechiae in the oral cavity, which may progress to caseous material. Treatment involves debridement, cleaning the area, and antimicrobials. Spinal osteomyelitis results in proliferative and progressive inflammatory lesions in the spine. It is thought to be related to chronic salmonella infection. Clinical signs include lumps along the spine and restricted movement. Treatment focuses on antibiotics, but these animals have a poor long-term prognosis. Snake fungal disease is an emerging disease in snakes in North America caused by Ophidiomyces ophiodicola. Clinical signs include crusting dermatitis, facial swelling, and opaque eyes. Treatment involves surgical debridement and systemic and topical antifungals. Inclusion body disease is caused by a virus that affects boas and pythons. The virus invades numerous cell types throughout the body and is transmitted by transfer of body fluids. Clinical signs include weight loss, regurgitation, and neurologic signs like stargazing. The disease is not treatable and typically results in euthanasia. Ophionissus natresis are the snake mites. Infestation by these mites can cause anemia or secondary infections. Clinical signs include coarse skin and spending a lot of time soaking in water to try and drown the mites. You may also see visible mites around the eyes in snakes. Treatments include permethrin or ivermectin. The main amoeba that affects snakes is Entamoeba invadens. It is transmitted by direct contact with the cyst form of the pathogen. In snakes, it often causes hepatic abscesses to develop. Clinical signs include weight loss, vomiting, mucoid or hemorrhagic diarrhea, and death. The treatment of choice is metronidazole. Cryptosporidiosis in snakes is caused by Cryptosporidium serpentis. The pathogen invades the gastrointestinal tract, causing thickening and loss of motility. Clinical signs include postprandial regurgitation and weight loss. Treatment primarily focuses on supportive care. Salmonellosis is considered to be part of the normal microflora of reptiles, and it is potentially zoonotic to humans. It is not recommended to try and treat the reptile to eliminate the salmonella in their microflora. Therefore, prevention of zoonotic disease involves assuming that all reptiles carry salmonella and washing your hands thoroughly after handling them. Scale rot refers to ulcerative to necrotic dermatitis. The early stages are sometimes called blister disease. Clinical signs include ulceration, blistering, or reddening of the skin. Treatment involves antimicrobials and debridement of the area. Maintaining appropriate environmental hygiene is important for prevention. Dissecdesis is incomplete or inadequate skin shedding. There are many potential causes, including things like low humidity, ectoparasitism, etc. Clinical signs include retained spectacles, which appear as a cloudy eye, as well as bands on the tail. Treatment involves moistening the skin and gentle removal. Thiamine deficiency results from feeding an exclusively fish diet to fish-eating snake species. Fish can be high in thiaminases or low in thiamine itself, resulting in deficiency. It typically results in neurological signs that can be treated by injectable thiamine or dietary improvement. Gout results from accumulation of urates in the organs due to excessive dietary protein, dehydration, or renal disease. Clinical signs include weight loss and refusal to move. Treatment typically involves correcting the underlying problem. Dystocia can occur due to a stuck egg or follicular stasis, which is where the egg follicles have failed to ovulate and form a large mass. Clinical signs include a distended abdomen and straining. It typically requires surgery to treat this in most cases. Vent prolapse can result in prolapse of the cloaca, colon, oviduct, hemipenes, or bladder. It usually results secondary to another condition. In this condition, you will observe a large mass extending from the animal's vent. Treatment involves replacing the prolapse or amputating the mass in some cases. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and share with your classmates. Thanks again for watching, and we will see you in the next video.